Oh, hello. Hi, and welcome to the Nursing Resource and Simulation Center. I'm Dr. Mao. I'm the Associate Dean and Director. And come, let me show you around. So this is where the students spend most of their time in the Resource Center. They practice all of their nursing skills, and we assist them, my staff and I, to perfect these skills when they're here. This is the nursing lab where you have mannequins and we have equipment that mimics a hospital environment, and all of the mannequins do something to help the students to prepare for their clinical and to help them perfect their skills. So let me show you the medication room. The medication room we're very proud of because not a lot of schools have a separate room where the students can mix their meds and also have the faculty here with them to prepare those meds and show them what they need to learn. We have a lot of supplies in here, a lot of equipment, and we have the Pyxis system, which is the dispensing medication administration system, which has the barcode scanner. So from here, we're going to go into the main lab. I'd like to also point out we have a de-stress cart here that we have equipped with lavender scents, aromatherapy, and coloring books so that the students can get a little bit more relaxed when they're testing, before they test. So let me show you the simulation lab. We have two rooms in our simulation lab, and the first room you'll see is our mother-baby room. This room is equipped for obstetrical simulations and pediatric simulations. We have high-fidelity mannequins here that actually breathe and talk, and the baby cries, and the sim mom, which is the mom, she delivers a baby, and the computer does show her contractions and the fetal heart. This is Sim Junior, also a high-fidelity mannequin. And then we have our newest acquisition, which is Preemie Sim. And our students named her Faith Rose. She's about a pound. So when our students are in their sophomore, junior level, they come here to do simulations. And simulations are a way to learn in a safe environment where they can actually make a mistake, and that's okay because they're here to learn. How we control those mannequins is through this room here. And the mannequins are all connected to these computers. So my staff or I will be here controlling the breathing, the blood pressure, all of the features that the mannequins actually do. So for example, for Sim Mom, when she is going to deliver a baby, we could make that delivery a very short delivery, a very long delivery, and that is in obstetrics. And pediatrics, we have the infant. The next room you'll see is the adult health room. And this is more for adult health, med-surg. So as you can see, it replicates a hospital environment as much as possible. So we have an emergency card here that if we are teaching students, or when we teach students emergency medicine, they can have a real code situation, and the students can actually assist in the code and learn how to. I'd like to take you to the back where we have our debriefing sessions, and that is after we have our simulations here with the faculty, we go to the debriefing room and then we talk about what actually happened. And here we are in the debriefing room. So the faculty and the students come here to talk about the experience in the simulation lab. And they are at the same time able to watch it here live on this monitor. We have this monitor also available for documenting on the electronic health record. The next room you'll see is the health assessment lab. And that is where the students learn to assess a patient from the head to the toe. So let's go there. This room is equipped with all of the necessary supplies and equipment that the students would need to examine each other and to examine the mannequins as well. There are task trainers here. These are task trainers that have abnormal conditions in their ears and in their eyes, because most of our students are young and they don't have conditions like glaucoma or anything like that, but they're able to see that with these mannequins, task trainers. I'm going to take you now to the telehealth center, which is right next door. So here's our telehealth center, and this is set up right now as a community room where we remotely visit a patient at home. So this mannequin right here, Aunt Lily, is waiting for a home visit from one of the students who's going to visit her via telehealth, our telehealth system. So we have the camera up there in the ceiling. The students can use that camera, or they can also view her through their own laptop or in the computer lab. So we have different options. They can also go in the control room next door, which is also set up for that. So they visit the patient in order to assess the patient remotely and to see how the patient is doing. In this room, we also do mental health simulations, and those are just an introduction into the psychiatric patient. Thank you for visiting the Barbara J. Toscano Nursing Resource and Simulation Center.